Hi, folks. John Adamson, the Rehab and Documentation Guru, getting ready to wind down for the night and get ready for bed. New work week ahead. And I got back last night from my last tour. I was in Cincinnati and Indianapolis. And I always like to read the comments from the people that come to my course. Helps me get a sense of what I'm communicating well, what I'm not, what I can do better. And it was kind of heartbreaking, one of the reviews that I got, because it was from a coda. And the coda wrote, prior to coming to this class, I was already feeling inadequate as a coda, but I feel even more inadequate now. And that was just kind of heartbreaking. I felt really bad. A lot of therapists have told me, coming to my class, they're hoping for tips to reduce their documentation, and that's not what my class is about. It's about making sure that you put on paper what is accurate, what gets you paid, what really demonstrates clinical excellence. And sometimes that takes more time. And so I hope to empower therapists that come to my course so they know better what to write. And when you know better what to write, you can become more efficient over time, but it takes practice and time like anything. And we've gotten in the habit of not having good documentation practices. We've become reliant on starter phrases from EMR, electronic medical records, and some of those starter phrases are frankly bad. I've gotten a chance to look at quite a few EMRs and some of the starter phrases that they use, and they're just not well set up for supporting medical necessity. And so, to those that have attended my courses in the past, and for those of you that have watched my videos, first of all, I would say please never consider yourself as inadequate or not knowing what you're doing, because you probably know inherently what you're doing with your patients, but you're just having a hard time putting it on paper. And that's, of course, the difference. Some people are good clinicians, work really hard for their patients, but they don't know how to translate that to paper. And paper, obviously, is just a part of the picture. And I'm convinced, though, that the better you get at putting things down on paper, what's going on with the patient, with clinical findings, your care planning, etc., you will become an even better clinician than you are now. But you should never consider yourself as being inadequate. I think the system has basically generated these feelings of inadequacy that a lot of clinicians are feeling, and I really do try to dispel some of that. So to that person that attended my course, if he or she, I can't remember what gender, but if he or she is watching this video, please know you're not inadequate. We all are growing, and that's what makes us human. We are not going to be perfect in any way. I certainly am nowhere near that, and continue to see every day the need for my own self-growth in the area of documentation, of clinical expertise, and I just try to do the best I can for my patient, and that's what I urge you all to do as well. Anyway, as we get ready for this week, I hope you have a blessed one, and as I see interesting topics, case studies, or get good questions coming my way, I will post videos on it. Anyway, John Adamson, the Rehab and Documentation Guru. Take care and God bless.